Hey, church family. It's Pastor Lori coming to you from my office. Usually I'm in that empty sanctuary bringing you a message, but today I'm sitting here in my office and I am surrounded on this Zoom call with three really important members of our congregation who are helping us discern how we're going to return, when we're going to return, and how we're going to handle our return. So we want to just bring you up to date with what is happening and what we're thinking and where we're headed for the future as much as any of us know. So let me just introduce you very quickly around the screen. We have Gisela Vega, who is our church moderator. We have Mark Wolf, who's our COVID-19 administrator. And we have Dr. Steve Wyrick, who is our physician consultant. So I'm going to turn this over to Gisela and let her lead our way here. Gisela.
Hello, church familia. As your moderator, I'm very excited to bring to you some of the recent discussions and happenings from our board. The board, the staff, our councils have been really critical in looking at how we return and how we do this safely, particularly during this time. We've taken our process for reopening very seriously, and we've taken our cues on making these decisions through good science, professional guidance, and thoughtful planning. We have, through the time, developed a reopening manual, appointed Mark Wolf as our COVID administrator, and have consulted with Dr. Wyrick, as our church physician. So thank you to both Steve and Mark, because, you know, without their guidance, this might not be as easy a process. Well, not that it's been easy, but hasn't as successful as a process as it has been. So now I'll turn it over to Mark to share a few words with us.
Thank you, Gisela, for your leadership as our moderator. I also wish to thank our congregation for their cooperation and patience during these unprecedented times. Let's not forget that someday our beloved church will reopen. Towards this end, I am working with pastors and staff on training and operation plans to safely reopen our facilities when that time comes. These plans will be based on the latest CDC and Miami-Dade County protocols. Out of utmost concern for the health and safety of our membership, our church will remain closed through October. In the meantime, we will continue our successful virtual operations. Although the COVID-19 data shows some signs of general improvement, there are concerning trends that convinced our executive council to keep our church closed at this time. To further explain this reasoning and the current medical data, I would like to introduce our physician consultant, Dr. Steve Wyrick.
Thanks, Mark. Thanks, Gisela. Thanks, Lori. What I wanted to do is I want to share some data with you that I think is pretty illuminating. This is compiled by the New York Times in consultation with the CDC and with the Johns Hopkins Center for Pandemic Study. And the top case goes from the very beginning of the pandemic to up to even including yesterday. And this is the top one. The red curve here is showing new cases throughout the country. And so this is where we peaked in New York when everything was, when New York was shut down, in New Jersey and Connecticut, and they were really the epicenter of this crisis. And then as things began to get a little bit better in New York, here around the around Memorial Day, when the rest of the country began to start opening up, we can see a few weeks later, the cases started rising and actually dwarfed the number of cases that even occurred in the Northeast. And as we're going down, we can see that here we are around Labor Day. And then as things began to open up more, and our county entered phase 3, we see the number of cases rising again. And the thing that's important, so these are the number of infections. Now we're tolling over 7 million people in the country that are infected. Behind that, about 2 weeks after infections, you start seeing an increase in the hospitalizations. About 2 weeks after the increase in the hospitalizations, you start to see an increase in the deaths. And this marks the deaths, the daily death totals from the beginning of the pandemic, where it really peaked in New York, when in New Jersey in the Northeast. And then things began to drop. And then again, about here we are in the Memorial Day weekend, and the cases were dropping and things began to open up. But then about 4 weeks later, it starts to go up again. And here we are where we really haven't exactly flattened the curve. We're still averaging somewhere between 800 to 1,000 deaths a day throughout the country. The other thing I wanted to share with you is kind of this dashboard that I look at about 40 times a day, because it helps guide me in my medical practice as well as just out of obsession. But here we are in the state, so this tells you the number of cases so far in the whole United States so far today. I do want to say that Texas and California notoriously are late in reporting their total numbers, including the number of deaths. But here we are in Florida. These numbers are hard. And so today in the state of Florida, we had 1,948 new cases and 173 new deaths. I think you might remember back to even as quickly as this last Monday, where the whole state of Florida only identified 10 deaths. I do want to caution that the number of cases and the number of deaths are always reported lower on weekends. And then they go up like on Tuesday and Wednesday. Compare this to yesterday, when we had 3,266 new cases and 101 deaths yesterday. And as we get back here, if you look into Florida, this even brings it down to where we are here in Miami. So just today, we had 314 new cases of COVID-19 diagnosed in the city of Miami-Dade County in our community. And there's 37 people, again, as we have always led, we've been the epicenter of Florida here in Miami-Dade County. So 37 souls lost their lives today from this virus. One of the things that I think that is important, I mean, we all need to be stewards of history, because it's the stewardship of history, so that we don't make the same mistakes. And people think, well, we haven't seen this kind of pandemic in a long time. And actually we have. We had the 1918, 1919 Spanish flu pandemic that affected the world, where before it was all said and done, there were over 50 million people in the world who died from this pandemic, and in the United States there were over 675,000 who succumbed to that virus. This is kind of near and dear to my own family, because I had a great uncle who had been the only other physician prior to me in our family, who had just finished his training. He had gone to Hopkins for medical school. He had gone to McGill to do a residency. He was drafted into the First World War, where he was an Army medic. And in the fall of 1918, he was 29 years of age. He contracted the Spanish flu and he died. That was a big tragedy in our family. The thing that, it's so interesting, because so many of the arguments that we're hearing today and the trends are not new. The arguments that, and there was the tale, as I like to say it, in the United States, during that pandemic, there were 3 waves. There was 3 waves, where the first wave killed about 120,000 people, and that was in the spring and early summer of 1918. And then the second wave came up in the fall of 1918 into the winter of 1919. And that one was about 5 times worse. They killed about another 500,000 people in that second wave. And then the third wave hit again in the fall of 1919, and that killed about another 80,000 people in this country. There's two cities that, kind of should be pointed out. There was the city of St. Louis versus the city of Philadelphia. And in St. Louis and Philadelphia, in the spring and summer, they were both hit pretty hard with this virus, with multiple deaths, many thousands of deaths. Those two cities are important because back in that time, they were two of the largest cities in the United States, both over a million inhabitants. So after, as you remember your history, on November 11th of 1918 was the signing of the armistice to end the First World War. And both of those cities, and so the troops are coming home. And that's about the time that my great uncle died, was right then. And so they wanted to celebrate the return of their veterans. So they wanted to have the big ticker tape parades to honor them. The city of St. Louis said, we honor our veterans, but we're not having a parade because it's just too dangerous. The city of Philadelphia says, we've been through this, the worst is over, we're doing it. They had a huge parade with over 400,000 people in the streets. 5 weeks later, there was 5 times the number of deaths in Philadelphia than there were in St. Louis. And they continued to lead that in New York City, to continue to lead the death rates in this country. So, that whole experience is often, it could be a harbinger for what we're experiencing now. And that's a large part of why we are considering not opening right away, waiting until we have sustained decrease of both new infections, sustained decrease in hospitalizations, sustained decrease in deaths, so we can keep all of you lovely people, our family, our church family members safe. And that's the most important thing. So.
Thanks so much for that, Steve. We are indeed a beloved community, and while we have a faith that is built on hope, and we will sustain and hold on to that hope, we are also built on love, and not only of God's love for each of us and our love for God, but our love for each other. And I think the best way to show that love is to keep people safe and well. We know you've got lots going on in your own lives, whether it's making decisions about kids in school or going back to jobs and positions, what to do with your social life, your personal life. And we don't want you to have to make another decision about the church. We have a lot of FOMOs out there, fear of missing out, folks, because we have such a fun, wonderful, warm congregation. And I just know folks are wanting to come back and see each other and wrap each other in our arms. But we think that this is our best decision for now. So we will keep you up to date. I know Mark will keep looking at the statistics, and he is leading us through how to re-enter with as much safety as we can. Steve is going to continue to be our consultant and help us, and Giselle has been an outstanding moderator through this very unusual year. So you got a lot of folks behind you and wanting to do the right thing. So please keep all of us in your prayers. We keep you in our prayers. And anything else, folks, that you want to say? Except thank you all so much. We love you, we miss you, and we look forward to seeing you soon. Bye-bye.